welcome to the Dr. Mary Lee Live Show. We're so happy that you're here with us today. We're continuing from last week. We're talking about the impact of the medical experiments that have been done on Black people for so many years. And so we're continuing the discussion about how it is related to the COVID-19 today, immunizations. And so we want to welcome our co-hosts, Dr. Tatum, Dr. Canon, and Michael Tynes. We appreciate your being here with us today. We want to welcome our guest, Dr. Tynes. Thank you for joining us. You want to say hi?
Yeah, I was just thank you for having us. Thank you for having myself, Dr. Tynes, Dr. Moncrease, Dr. Davis, and Dr. Long. And also who helps us is your historian and researcher, Michael Tynes, and as a public health care team for the city of Benton Harbor.
Okay.
So thank you for having us here in this discussion.
Thank you. We're so happy that you're here. And in the studio here with us today is Dr. Curtis Longs.
Again, Dr. Mary Lee, thank you for inviting me. Glad to be here to offer whatever I can to our community.
And Dr. Walter Davis.
Thank you, Dr. Mary Lee. I'm very happy to be here because I will give plenty of information. I think when I give information, it's going to be more questions that will come up, but I will give you, I think informed is our best defense against this.
Thank you so much. So, we're just going to recap a little bit about last week's discussion, our introduction basically to today. We talked about Dr. Tynes and our guest last week stated, and hopefully I get it all right. If I don't, I know I'll be corrected, and that's fine. Physicians do not run medicine anymore, but business people do. And there's some business people who want to mandate the carrying of a card verifying that one has been immunized with this COVID-19 immunization, which is personal and private information. So, why are we maybe asked or considered to be willing to give away or present our personal and private information? Business people, because they're running this thing, some may want to mandate the vaccination to return to work, maintain employment, or you could lose your job. Salaried physicians working for private and public facilities really have no voice today for their patients or on behalf of their patients. And we've been through a pandemic before with the H1N1. And so we know at least the medical world knows what it takes for an immunization to become a licensed immunization. So COVID-19 vaccines have not completed all of the steps medically required to be a fully licensed vaccine, which would include a stage 4 step, which is a massive inoculation of patients, which this process normally would take about 2 years of study, observations for side effects and other outcomes, whether good or bad, of patients to move into the licensed vaccine stage, okay? So step 4 certainly has not taken place with this COVID-19 vaccine. So with COVID-19 vaccinations, we're in what I understood, and of course I'm not a medical person, I'm just recapping, stage 3. Because stage 3 is a gathering of information stage upon consent of the patients. So the participants have to give consent. And I don't know whether people know that or not, but so it's a study phase which is required to be approval. And so by definition, we're in a stage that may be defined as any of these, okay? Based on, I believe it was the CDC thesaurus, I'm not sure, but investigation, research, experiment, study. These would all define the stage that we're in right now for this COVID-19 immunization. And also, there have been some misrepresentations to the public that this is not new technology. When in fact this is new technology, the DNA, and I forget something called mRNA, and I can be corrected, are this new technology. And so we're basically in a global international study with these vaccines where consent is required. However, we're giving consent. I mean, I suppose when you go and take it, you're giving some type of consent. And but that consent, unless you understand these phases or these different stages and understand the technology, is an uninformed consent. But even with this uninformed consent, if you become sick or have a serious allergic reaction or even die, there's no recourse. We're not given, the patient isn't given any recourse. If you die, family's not given any recourse. So, but it's still considered voluntary and a voluntary participation. Okay, so educating the public is essential for being well informed relative to everything that we've stated here. And some employers are maybe, and I'm kind of lost on this one, maybe wanting you to sign a waiver. Statement was made, do not sign a waiver. So this is where we want to pick up. Want to know, what is this waiver and why would we want to sign it? What is it all about? Dr. Tynes.
Yes, thank you. I presented the fact that right now it was set up that the vaccine companies, the manufacturers, producers, distributors, those who administer the vaccine have immunity, that you cannot hold them harm. You can't hold them harm if it comes to you, injury comes to you, death comes to you. They are exempt from that. That was put out there. But when companies are trying to force you to take the vaccine, they do not fall under that exclusion that the Donald Trump administration had put in place to protect them. So that way you would write a statement that you're not taking this under your own free will, that you're being mandated by your company or by your business that's forcing you to take this vaccine, and that you're holding them responsible for any hurt, harm, or death. So you shift it back on the company, and I think that's what brought attention. So Dr. Longs had took the vaccine, and he can tell you that there was a sheet that told you that, one, that the vaccine was not licensed, two, that the vaccine was still experimental, three, that there was no vaccine licensed or approved in the treatment of COVID-19, period, and that you sign these statements that you understand this and that you're taking this on your free will. And they also let you know that if you're pregnant or breastfeeding, that there is no data to substantiate or support you taking the vaccine. That is also the words of Dr. Colbert, the developer of the vaccine, that they cannot recommend it to autoimmune patients or patients who are pregnant or breastfeeding because they did not study it. And they left it to the doctors who are down. Here's Dr. Colbert and NIH and Dr. Fauci. They left it to the doctors down here at the base, at the totem pole to make a decision that they're not knowledgeable enough, that the people up here cannot answer. If Dr. Colbert, Dr. Fauci, and these guys, NIH, cannot say to do this, how could you, as a medical organization or an individual physician, make a statement to encourage somebody to do something that the developers cannot say or do? So that's where we are, where people are being misled. Their egos are getting in the way, and they're telling people to take a vaccine that they have no knowledge of, and in terms of the area of autoimmune disease, pregnancy, and breastfeeding, and they're trying to extrapolate apples and oranges, say that we know what happened with the oranges and in terms of regular vaccines, but this is a new vaccine of DNA and messenger RNA that has never been seen and given to anybody on the face of the earth until we probably started the study, and now in mass in January. So the mRNA virus we know now is just over a month old. The next one that just came out now is not even a month old in terms of Moderna.
Okay,
So I'll
thank
turn
you
that
so much.
back to you.
Thank you so much, Dr. Longs.
Picking up from last week, and I had made some comments and regarding Dr. Tynes, his Facebook post as well as his posts in the newspapers. And so the point I wanted to make that was that in general, our population, they don't know what a consent is. They don't know. They have no clue what the definition of a consent is, and it had me really think about that in terms of what I do in my private office. So, yes, I took both components of the vaccine. I remember signing some typical stuff that I would know about because I'm a physician and I have individuals in my office sign for consent for treatment, consent for meds, consent, let alone HIPAA. So I went to my office and I looked at what we have in the office. I'm like, wow, if I'm looking at this 8-page sheet regarding consents and HIPAA from my own office and really looking at it, and really you have to be an attorney to kind of understand all this, which is, by the way, most offices will have an attorney complete a document like this, but this is a really a legal document. I started looking at it closely, for research purposes and things like that. So there's no way in the world that members in our community understand the parameters of what a consent entails, which is, you have to, it's voluntary, then the whole idea of comprehension of what you're signing, what you're signing up for, and at the end, authorization for it. So, yeah, truthfully, in getting the vaccine, we had ours in Wayne, Michigan, we had one paper. Now, I was in the car with our medical director, myself, and 2 nurses. So we're used to seeing these, and we can kind of go through it. Okay, we've seen this, but I'm looking at all the cars in the back of us. They have no idea about what all this stuff entails. And
so you're saying you had only one paper? You had one paper to sign?
so we had one paper to sign. We're in the car. A lot of people were surprised that we didn't get out the car. We didn't go into a building. No, you stuck your arm out the car and that was it. So, but at the same time, we're reading these documents, signing and whatnot. We're aware of that because this is what we do with clients. But compared to my own office, this is 8 sheets on top of a consent. So it's just important. It's very important for physicians in the community to spend the time and educate the population, and particularly your clients, as to whatever you're doing, no matter if it's a surgical procedure, medication, but particularly with this vaccine. I don't regret getting it. Only thing I'd say is that the promise of hair growth, I haven't seen that yet. So that's and I'm joking, of course, but it's important for our communities to be educated and enlightened. Yeah, for sure. Yeah.
Dr. Davis, thank you for joining us.
Oh, no problem at all. I want to give the perspective. I headed up the H1N1 response for the city of Detroit with H1N1. And so I'm very aware of the vaccines, and I want to educate our people in terms of what we're actually dealing with. And so, like traditional vaccines, we grow viruses, then we either kill them or we weaken the viruses in order to introduce those viruses into our body so our body can generate immunity without actually getting sick. What we've developed for this coronavirus is a brand new technology called messenger RNA technology. And what we do is we take messenger RNA from the virus and it codes for a specific protein. It's called the spike protein. And then what we do is we introduce that into through the vaccine, we introduce that messenger RNA into our bodies so that our bodies will incorporate in that messenger RNA and start making the spike protein. Now, there's a couple of potential issues here that, I'd be kind of concerned about. And as was already said, we haven't gotten to the place where we've tested it on a huge amount of people. We've had the normal testing, the stage 3, 60,000 people between Pfizer and Moderna. But we really don't know ultimately how people are going to respond to this introduction of messenger RNA. And we've utilized what they call nanotechnology, where in order to introduce this messenger RNA, we had to encapsulate the messenger RNA to protect it. So we're actually trying to artificially mimic viruses, because we looked and saw how viruses actually introduce their, and so we created a shell, and that's where they talk about the polyethylene glycol and all that. We created the shell that will gain access into our cells to release the messenger RNA. Then our cell, the whole cell, starts producing this protein, the spike protein. Then it's introduced, and our bodies can recognize it as being foreign and form the immunity against it. What Dr. Tynes was saying is that we've gone so fast, and we don't really know exactly what the messenger RNA will do in the long run. So they've used the stage 3 and said, we did the testing on this number of people, but we really, typically it takes years to kind of see. You do it with a certain tens of thousands of people and see how they respond in the long run before you typically give authorization. So this emergency use authorization, what the government has done, what the governments have done, is they said, well, we're going to look at risk versus benefit. And they said, this virus is so new and it spreads so fast that we need to set aside some of the protocol, not normal protocol, in order to try to keep it at bay. And I'm not saying that's wrong. I'm just saying that I think it's good for people to understand that it is an untested technology that they're utilizing. And that's where Dr. Longs was saying in terms of what are we really consenting to. And so that's the mRNA vaccines. And both Pfizer and Moderna use mRNA vaccines.
How many types of these artificial characters are being introduced to our bodies when this vaccine is taken? So,
well, there's millions and millions of them that are introduced through each vaccine. You talking to me?
No.
Oh, okay. All right. Yeah, there's millions that are introduced into our cell, into our bodies with the vaccine, so that they can, so each cell, basically we're sacrificing certain cells, because once that cell gets this mRNA introduced and it starts producing that protein, our immune system will destroy that cell, and that's how our immune system learns. And then, but what's interesting is they have a lot of other vaccines that are being developed currently. And right now, I guess Johnson & Johnson is just getting on the forefront of being released. And they use what they call the viral vector vaccine. It's a viral vector vaccine. And once again, they were able to, viral vectors have been used since about the 90s. And so that one at least has a more better track record. But the thing is it actually uses DNA.
Okay.
So what they do is they take a virus that we're used to, that typically an adenovirus, like a virus that you get, the common cold, things like that. But they take an adenovirus and they modify it so that it can't replicate itself.
Okay. So we've definitely got a business people competition for this virus, for this money that is potentially going to be made through these by these pharmaceutical companies. We're going to go to our we're going to go to Dr. Anita Moncrease. Welcome, and thank you for joining us. If you would please just tell us a little bit about yourself and where you your profession fits in this within this whole topic of COVID-19, your experiences and your position, please. Thank you.
Thank you for having me. It's nice to see everyone. I'm Dr. Anita Moncrease, and by training, I'm an internist and a pediatrician. I'm out of Detroit. Went to medical school at Wayne State, and I'm a professor there at Wayne State University in the Department of Pediatrics. I'm the historian from my church, Hartford Memorial Baptist Church, and I just love this the dedication of this team of folks, Dr. Tynes, and Dr. Davis, and Dr. Longs, to getting the message out to people, answering their questions. Where do I fit in this? I fit in this more as a consumer who is trying to gather information and trying to make the right decisions like everybody else. You know, pre-COVID vaccine, well, we had a period of pre-COVID, and then we have COVID, and now we have periods of pre-COVID vaccine, and now we're in the periods of COVID vaccine. So we're creating a historical timeline that we're following every day. We're getting information from different sources, and the motivation behind that information is different things. Financial motivation, fine, as long as the information that I get is correct. You know, I'll just live with it being a financial motivation. What I'm concerned about is if the information is not correct. I don't care if the motivation behind it was, you know, trying to do the right thing. I need correct information. So that's what that's where I'm coming from, and that's where I'm going to try to share.
Okay.
First of all, when I think about the pre-vaccine period, I think about us walking around with masks, safe distancing, washing our hands, and I also throw putting gloves in there. And we talked about this several months ago. And now that we're able to get the vaccine, those of you who have taken the vaccine and those of you who are considering taking the vaccine, now we're at the point where, okay, some of us have had the vaccine. So how are their lives different? Okay. Do they still have to wear masks? Yes. Do they still have to wash their hands? Yes. Do they still have to practice safe distancing? Yes. So what actually changed? What was the impact of them, you know, having the vaccine? And people ask me that question. Well, should I take the vaccine if I have to do the same thing that I was doing before?
Right.
Okay. And I this is the best answer that I can give. Okay. Black people are not the same. Okay. Everybody wants to throw us into one category, like we all think the same, we all do the same things, da 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 da. No, black people are just like white people. We are individuals. We like to make our own decision based on the facts. The fact of the matter is that the vaccine is not going to prevent you from getting COVID. I think that point has been made several times, but for some reason, people don't understand that. The vaccine does not stop you from getting COVID. That's why you still have to use those same precautions. If it stopped you from getting COVID, as soon as you got that first or second shot, then you can take your mask off. You don't have to worry about washing your hands as often. You can go hug as many people as you like. Okay? But because it does not prevent you from getting the virus, you still have to take safe precautions. Then you say, well, why do I have to take the vaccine then if it's not going to stop me from getting COVID? The theory behind it and the short-term effects that people have seen from getting the vaccine is if you do get COVID, it's not as bad of a case. Okay? So you don't get as sick. If you didn't have the vaccine, you get whatever sick is for you. You know, some people got real sick and died. Some people didn't even know that they had it. Okay, if you didn't have the vaccine, you didn't even know if you had the COVID infection.
But so you won't get as sick as you would get, but how do you know how sick you would get?
That's my point that I'm making.
Okay, exactly. How do you know how sick you're going to get? So,
okay, you don't know. Okay, but the assumption is that, and the data I am told shows. I don't know what the data is. Okay, I'm told the data shows that when people do get COVID, they don't get as sick, and you don't have the deaths associated with the COVID infection. Okay, so that is measurable. Okay, so the people who get the vaccine are not supposed to get as sick, and you're not supposed to die, and that's a great motivation. Okay, I don't care what color you are to get the vaccine. Now let me back up and be a little bit clearer. Okay, if you get the vaccine and you don't get as sick, okay, then why don't we all just go ahead on and get the vaccine? Particularly those people who are in high risk groups. Okay, the people who are in high risk groups, like the elderly, theoretically, diabetics, people with heart disease, people with respiratory diseases like asthma, people who have chronic diseases like that. Pre-vaccine, and being black is a high risk factor, and being obese is a risk factor. Pre-vaccine, those people tended to do worse when they got the COVID infection. Okay? The theory is post-vaccine, they will do just as well as anybody else. Okay? So their course with the disease won't be long. They won't develop the chronic complications of COVID, and they won't die from COVID. Okay? Short term, and I can only talk about short term because we've only been giving the vaccine out since January, and this is February. Getting ready to go into March. So I don't think there's nobody. I don't care if you're in a research lab 24 hours, 7 days a week, who can answer the question. What's going to happen to these people when they get the vaccine 2, 3, 5, 6 months out, a year out, because nobody knows. Okay.
Thank you.
In the studies, when people were actually doing the studies, they have data out from those people who are in the studies, 40,000 people. We're talking about immunizing millions.
That's right. And can I just jump in here right now? I want to, and I totally agree with you, but we want to give our co-host an opportunity to ask questions, make a comment, starting with Michael, please. Michael, then Dr. Tatum, then Dr. Canon.
Yeah, thank you, Mary Lee. Can you hear me okay?
Yes, we can.
So I had a question of clarification actually directed towards Dr. Davis regarding something he mentioned about the novel way in which we're developing, or the medical industry is developing, a response or treatment to the coronavirus. You mentioned something about an artificial capsid or artificial viral shell, and I was wondering if you could, drawing from your medical expertise, just maybe give us some insight on some possible implications of using an artificial viral shell and some of the nanotechnology that you said was being used.
Well, the messenger RNA doesn't naturally just go into a person's cell. It doesn't pass through. So we use nanotechnology. They use nanobots, and so they actually encompass the messenger RNA in a lipid coating so that it can pass through the plasma membrane of the cell. And so now that technology has been used for a long time. It's been used. They're pretty stable. They don't interact with our bodies. The thing that I mentioned, the reason I mentioned it though, is because that has a lot of potential impact, especially for African Americans, because when they start dealing with this nanotechnology, in this situation, they put a messenger RNA to get into a person's cell. They actually have capability, and they do this, where they actually put substances in some of these nanobots, inject them into people's bodies, and they go into cells, and then they can actually track where that actually goes in a person's body. They can use an MRI to actually track that actual nanobot. And so it just has some interesting potential repercussions in terms of tracking people, even when you go through, they have the technology available where they can actually inject someone with something and then track them.
Right.
And, I've heard people say, well, maybe they can track people that have been vaccinated. Well, I don't think they're using that in this instance, but it's just that it's out there, and I think people need to be informed that possibility
That there
arises.
is a possibility
Yes.
for it to happen, and this is what people are saying. Many people who are opposed are saying, what is going on here? Are
Right.
they implanting something within us, some type of detector to trace where we are? And personally, I don't put anything beyond any of these people. We're going to go on to Dr. Tatum at this point.
Okay, my question is surrounded by the Johnson & Johnson introduction of their vaccine. Do you think the expediting this particular vaccine is because of the lack of the one that they're currently using? What would be the reason for going forth with the Johnson & Johnson?
You want me to answer that?
Yes.
Well, they have over 100 vaccines that are in different various stages of trial. And the thing is that ideally, they want everyone throughout the world to be vaccinated. And so if you look at Pfizer and you look at Moderna, if it was just Pfizer and Moderna, just for the United States, it would be 2023 before they'd make enough vaccine to even cover all of the United States. So they need these other companies that are developing vaccines to supplement and be able to cover all the people in the world.
Okay, thank you. Dr. Canon.
Beautiful, everybody. This is outstanding conversation. I hope everybody can hear me. With this, we looked at the fact that Donald Trump ended up coming down with it. I think many of his staff came down with it. They seemingly recovered, and we didn't hear any emergency life. I fear the information that's coming out causes a lot of fear in us all across the country. It sounds we have the right to reject this a mandate to go back to work, a mandate where it has to be, it's demanded. Do we have the right to say no based on this is laid out? They're mental, we're not sure, so therefore our employee says you cannot come back to work unless you take this experimental drug. As you said, it's not even guaranteed that you won't get COVID, but your employee is demanding to take it. What is our recourse? If I don't want to take it, I don't believe in it, I don't trust it, I don't want to take it, is our recourse that because this is experimental, you don't have to take it?
Is that directed to a particular person or just whoever would like to answer?
Yeah, I'm just trying to get clarity, whatever clarity. Is that an out for us to be able to say to our employees, I'm not going to take it, but I still want to come back to work?
Dr. Longs.
The thing that I would add was in the metropolitan Detroit area, I work at various places. And the place where I would say I base my decision to get the vaccine would be the juvenile detention facility where we have kids, some young adults, and in full capacity we have 250 kids there. Usually when you hear about juvenile justice, you think crime, but we have a large population of kids who are there by way of CPS, DHS, etc. So just based on trying to be a good physician, do no harm, etc. The impetus for me getting this vaccine had nothing to do with Wayne County, JDF, or any other entity. It was really, it would be so, I don't know if I could still work there if I ever came down to the virus, with the virus and infected any of these kids. Now, we've had kids come in, again, DHS, CPS kids on the run, homelessness, etc., who come in. We haven't had a lot of cases, but we've had kids who tested positive. So then the risk of us catching this is really based on them. So it's back and forth. But in general, there has not been a mandate in Wayne County. Now, there was a statistic offered this past week with DET with Stephen Henderson, who was talking about how many Wayne County sheriffs have been vaccinated. And the reason I'm bringing this up is because the Wayne County sheriff, Pride of Detroit, Detroit Sun, Native, you name it, Benny, Benny Napoleon, who passed, and that's devastating.
Right.
Not only for the Wayne County Sheriff Department, but for Detroiters, metropolitan Detroiters, period. So the statistic is that only 62% of the sheriffs have decided to get the vaccine. Now, of those 62%, majority of them are Caucasians who decided to get it. So
it's not mandated.
No, it's not
mandated. It would
mandated.
really take an attorney, a legal person, to answer this question.
Yeah.
Whether or not, what type of recourse would one have? So we're kind of winding down now. So we'd like to get Dr. Moncrease to summarize for your final thoughts.
Well, I just wanted to. I guess my final thought would be on this question. No, it's not. There is really no venue where it's mandated that you get the vaccine. But what's going to happen, and you guys may have mentioned this earlier, I don't know, is some employee, or for example, flying, while you may have to show something to prove that you've been immunized before you get on a plane. So while it's not mandatory that you get the flu, that you get the COVID vaccination, they might not let you fly unless you can prove that you have it. The people even in prison have the option of whether or not to get the vaccine. They're starting to vaccinate people who are incarcerated. It's their choice. Okay, those who have chronic illnesses, they're encouraging to get the vaccine, but they can't make you get the vaccine. And as far as your employees are concerned, your employer can't make you get the vaccine, but the employer has the right not to let you work unless you get the vaccine. And so you're going to start seeing lawsuits around that. Okay, they can't make you get the vaccine, but you're not allowed to come back to work unless you have it.
Yeah.
So those are the things that people are going to be faced with. So I guess that's my summary.
Thank you so very much. And so you're in an individual, as in a catch-22 right here. To are you going to give up your employment? I mean, in the event that you can't come back. So we've got just 3 more moments left. So we're going to ask our co-host for like a minute and summary, and then we'll get to Dr. Davis to give his summary, and Dr. Long's. Starting with Michael.
So I appreciate all of this very substantive and educational dialogue that's going on here, because this is the kind of conversation that needs to take place in the community to help educate people and raise their level of awareness to issues like this. And unfortunately, African Americans and their say, or their 2 cents being taken out of the matter, has been a constant and historical precedent, really, that's been set in this country. Gone all the way back to South Carolina Medical College in the antebellum period. In the prospectus for that college, one of the things that college advertised was that they had a large supply of Africans to experiment on for the medical students. So unfortunately, it's something deeply I know is baked within the fabric of the medical system, which is the disregard for African Americans' 2 cents, as well as going to inform them. So I thank all the people all the people on the panel, and the professionals for filling that void and bringing that information to us, information that we don't have usually.
Thank you so much, Dr. Tatum.
Thank you so much. This is very, very informative, and as a pastor of a congregation here in California, is very important as leaders, because a lot of your parishioners look to you for direction. And I've been very cautious to let them know that I will never tell them not to take the vaccine, or let that be your conscience between you and God. So, but being informed can help them make the right decision. So I appreciate this, Dr. Lee.
Thank you, Dr. Canon.
Beautiful. I appreciate it as well. One last clarification, if I can get the doctor that said he worked with the N1, H1. I'm curious, was all the symptoms, when people came down with that particular disease, did they all have the same symptoms, or did they have different symptoms, just like what we have with this disease? Is it common for a virus to have different symptoms on different people, or one with all the symptoms the same?
Dr. Davis.
Yeah, that's a good question. And see, a lot of people, you need to understand where the symptoms come from. The symptoms don't necessarily come from the virus itself. It comes from your body's own immune system responding to the virus. So the fever, the muscle aches, the fatigue, all that comes from the body's immune system response. We release cytokines and interleukins that the immune system actually release. And so a lot of the symptoms from H1N1 are similar to, because it's the flu, it's like similar to the symptoms that you have in the for this coronavirus, but it depends on the individual. So each individual is dependent on how their body's responding to it.
Thank you so very much, Dr. Longs.
I was just writing here how kind of sum up some things, and I'll leave this for my colleagues and other members in the medical profession. Consider this: big business doesn't allow you time for informed consent, because that's basically where we are. You need to see this person right now. You need to see numbers, protocol with CPT codes and all that sort of thing. Big business isn't allowing us to practice like we know we need to practice. So informed consent sometimes goes by the wayside, unfortunately.
Thank you all so much. I want to thank all of you for joining us, our guests, our co-hosts. I appreciate you very much. I think that the bottom line here is that we want to eat well. We want to take our vitamins, our supplements, and do all that we can do to keep our own immune system strong, because at the end of the day, it depends on how healthy we are, how our immune system, our natural biological system that God has given us already to fight for us, because that's what is happening here. Our system has to fight for us, whether we have the immunization or not. So I appreciate you all. Thank you. Until next week, Dr. Mary Lee Live. Stay safe and stay well. Thank you.